I would like to know what your name is and what kind of work you do, if possible, and just what you are hoping to learn from this workshop. So may I invite you to just start off? Shall I volunteer you first?
All right. I'm Susan James. I just started, I'm a new colleague of Issues at Counselling. And I have read some of the articles on Morita Therapy, and I'm very interested in it, so I'm interested in sort of hearing it in a dialogical sense as opposed to just reading about it.
Mm-hmm. Thank you, Susan.
My name is Hazel Friegel. I'm a counselor. I work primarily with First Nations people right at the moment. I'm in private practice, but all of my practices deals with the community I'm learning in Vancouver Island. And I've had a long interest in working in a holistic way. The specialty is trauma therapy, but it's that's my specialty. That's what I focus in on. Very much want to work in a holistic way. So, and working in I'm not First Nations myself, but I've had a long history in association with different communities. So, I feel like I fit really well there. And the expectation really is that we work holistically. They're developing their own community-based processes right at the moment. So I'm really interested in any kind of cross-cultural insights and different kinds of therapy.
Okay. Hazel, thank you.
I'm Nancy Blunder. I'm a psychologist from Japanese Morita. I'm in private practice. And I work with sexual offenders and sexual abuse victims.
Mm-hmm.
And I find emotionality is a really important aspect of both of those things, trauma as well as sexual offending. It seems like not being able to control emotions or controlling emotions through sexual acting out. So I'm interested in them going toward the anxiety thing.
Mm-hmm.
I'm really intrigued.
Thank you. Nancy. Okay. Hi, yeah. Please come and join us in the front. Do you want to join us in the front? So that was Nancy. Thank you.
I'm Cheryl Cohen. I'm a psychologist. Also, I work in community mental health and cognitive health here in Richmond. And we see a lot of children with anxiety disorders now, but also so many parents that have a hard time letting their children experience anxiety and therefore allowing their children not to experience life. So really, and I have done some reading therapy, so I'm really interested in talking about particularly how we can help parents with their anxieties about their children.
Mm-hmm. Thank you, Cheryl.
My name is Ross Fetty, and I live in Vernon, British Columbia. And I remember reading a book on Morita Therapy in graduate school 20 years ago, and saw the workshop, so I became interested in revisiting it. And the kind of the principles seem similar in Buddhist thinking about being present and detaching and being in the moment and being with the experience and observing it, not being attached to the experience. So some kind of relationship between Morita and other forms of working with folks.
Thank you, Russ.
My name is Cynthia Wong. I'm just a recent graduate from the Alpha School in Chicago. And I'm interested because I'm an arts committee member, and one of our artists has found interest in Buddhist culture.
Mm-hmm.
And his paintings, his name's called Alistair. And also like other people before me, interested in going towards as opposed to control.
Mm-hmm. Thank you, Sophia. Welcome.
My name is Andrew Martin, and I
And I chose this conference. Number one, because I struggle with anxiety myself. And I see this as an opportunity.
Thank you. Angela. Sure.
When I was reading the introduction to this workshop, what caught in the last meeting was the idea of being able to relax into
Mm-hmm.
anxiety.
Okay. Thank you, Angela. Yeah. All right, that's fine.
Howard, this room with perspective of here. I'm an osteopath and naturopath private practice. My partner's a psychologist, and she's giving papers here. I was quite interested in a number of the conferences and talks and workshops here. This one pulled my interest. We recently attended a conference on trauma. I was quite interested with John Greer and others' view of affect regulation. Tied in with that.
Thank you, Howard. Welcome.
It's Robert, and I'm one of the volunteers here. My ship doesn't start until after Thanksgiving. Which conference I and I chose this because I'm interested in hoping I could get some knowledge and add some tools from the clients.
Mm-hmm. Awesome. Thank you, Margaret. Welcome.
I'm Kristen Price. I'm a psychologist. I manage emergency psychiatric services at a hospital in Vancouver, Washington. And I'm here because anxiety and affect regulation is an important part of it.
Thank you, Christine. Yes, please. Yeah.
I'm Vincent Tang. I'm a GP family doctor in Vancouver for the last 18 years, and I rarely cure anyone, so that's why.
Thank you, Vincent. And thank you. Mm-hmm. All right. So some of you already have the basic or cursory knowledge of Morita therapy, and many of you, all of you, are interested in finding out more about what this approach is, and also personally benefit from it. And hopefully, I can fulfill not all, if not all, many of your expectations. I've got handouts, and in case you came late. Let me give you, can I just grab those two? There are 4 handouts, so in case you came late, but I guess that's yours, right? There are 2 journal articles and then 2 handouts. So would you like? Sure, take one. So, yeah. Most people have picked up, so. Sure. Yeah, you have a set of 4 printed items, 2 single page and 2 journal articles.
I need 2 more.
You need 2 more. 1, and then 2, 1 more article. Oh, there are more here. one have you got? All right, so that's it. All right, anyone else? Which one do you need? This one. All right. Yeah, there are more. I think there are more. Oh, here. I've got 30 copies, so I'm sure we have enough. Yeah. Yeah, that's fine. Sure. All right. You're looking at the photograph of Shoma Morita, born in 1874, died in 1938. And the approach that he developed in the early 1920s, or just before 1920 actually, he had been exploring the different Western approaches to treating psychosomatic and emotional problems as a psychiatrist. And he had tried things like the hot spring approach for relaxation, the hypnosis. Sigmund Freud was his contemporary, so Morita always kind of regarded him as his rival, the Western rival. He had done some work around meditation and more insight or reflective kind of approaches. And in treating his psychiatric patients, he was not successful. Using so-called Western modern psychiatric approaches, including medication. And later he found that many of his clients, say, digestive or intestinal problems were psychosomatic or psychogenic to a large extent. Also, many of his patients were experiencing various types of anxiety and panic disorder, and simply using the persuasive approach was not effective either. By saying, calm yourself down, he wasn't successful in helping someone. We often say those things to each other. Parents say that to their kids. Calm down, relax, don't be afraid. Morita Therapy is the name that Morita's disciples used to describe his approach. Morita never called his approach Morita Therapy. It's like saying this is Ishyama therapy because I developed it. He called it special treatment for nervous patients or shinkeishitsu type patients. But later to I guess, capture the Morita's own unique approach and conceptualization, people started calling it Morita Therapy. Morita Therapy has a number of dimensions, so to speak, and sometimes I overemphasize the counseling aspect because I work in that area. Morita Therapy has the residential dimension, which is the original, probably the purest form of Morita Therapy, and then outpatient approach in a psychiatric context. And then there is an approach called, I call it counseling application, or Moritian interventions that are embedded in a more general counseling approach, not really bound by a particular theory or approach, but people can incorporate Morita in a small way, not necessarily in a big way. I call it a non-convergent approach. You don't have to be converted into a Moritian counselor or therapist. You can just learn how to use it and then plug that into your own approach, your own system of thinking if you find it compatible. Morita therapy has also been applied to educational settings and also working with the cancer patients and people with the intractable diseases, people who are facing death and experiencing the fear of death, at the same time wanting to live their lives fully and find meaning in life. And there is an approach that really uses Morita therapy's basic principles. It's called meaningful life therapy. Hi, Paul. Meaningful life therapy, and I'll talk briefly about that. What I plan to do today, this morning, is to talk about briefly about sort of an overall picture of Morita therapy first, and then get you into short learning activities or experiential activities, and then we'll use some reflections and insights as the sort of a starting point for discussing some of the conceptual issues. I will also talk briefly about the cultural aspects of Morita therapy, especially around Buddhism. And I'm not sure how many of you are familiar with sort of precepts or foundational thoughts about life in a Buddhistic system. So hopefully we will have a discussion as well. Good morning, good to see you. All right, handouts. One of the handouts has the list of key concepts, and I just want to go over that first. So by attending this workshop, you not only learn Morita therapy, but also acquire some Japanese language competencies. All right? So just quickly going over the 9 key concepts. One is shinkeishitsu. It's a Japanese word for the nervous trait. Sometimes, in the past, the German word Nervostat was used. We just call it nervous trait or nervous personality. And shinkeishitsu, which is the neurotic symptoms of the nervous personality. Morita's successor, Dr. Koda, the late Dr. Koda, differentiated between shinkeishitsu as a personality trait and shinkeishitsu, which is the neuroticized aspects or expression of the nervous trait. You can be a nervous person or the person with the various nervous disposition, nervous and anxious dispositions, but you might be able to use those qualities in a positive way without being bound or controlled or engulfed by such qualities. While some other people become so preoccupied with their symptoms, and the symptoms actually swallow them, so to speak, and their symptoms become fixated and even get exaggerated to the point of developing fairly debilitating neurotic or disordered state. Taijin Kyosho is a very Japanese, it's considered a very Japanese or culturally unique type of social anxiety, and I'll talk briefly about that later on, but TKS and social phobia, which is a Western concept, or the DSM concept, are similar in some ways, but different in other ways. One of the most culturally unique features of TKS is that people worry about how they might be offending others. I think this side will get better if people exercise a bit more TKS in that respect, But in a certain culture that's more collectivistic and other-oriented, you become over-concerned, and in a way, in a self-defeating way, you become preoccupied with thinking what others might be thinking about you. And that's been classified in DSM as sort of a paranoid type response, which goes into a different kind of category, but that's a sort of a cultural aspect. Attentional fixation is something that recent cognitive and cognitive-behavioural therapists and researchers have been discussing how the focus of attention could be used or misused in terms of dealing with personal and emotional issues. That you could be over self-focused, and that becomes a form of self-absorption. Some people become so consumed with, say, fear of death and illness, they become hypochondriacal in their lifestyles. So attentional focus is very important. In Zen Buddhism, for example, you focus your attention on here and now, the present experience. In martial arts training, for example, you have to be focused, otherwise you get hit. You have to move and respond to a realistic situation. In the flower arrangement and tea ceremony, you have to pay attention to every movement, how you turn, how you rotate the tea bowl in the ceremony, how to bow, how deeply you bow, what to say. Those things require fine and refined attention, and that forms a part of a culture too. But if you're self-consumed, your attention is too inwardly directed. You fail to attend to what's happening here and now. Someone said, here and now, present focus, and that's really a key aspect of Morita therapy. Ideational contradiction refers to how we think does not fit necessarily into how things are. I might say I should be a perfect and fluent speaker and be entertaining at all times, but in reality I might fail to do so. Or I might say it should be a nice, warm, sunny day, and you step outside and it's raining. You just have to accept it. But for some people, that disparity or gap between reality and ideality becomes a source of preoccupation, especially when it comes to emotional condition. If you say to yourself, taking sort of macho-like approach, saying, I should be self-confident, I should be brave, etc., but in reality you experience fear, anxiety, diffidence, and then you get caught. You might say, I shouldn't be anxious, I shouldn't be nervous. And that creates the sort of vicious cycle of self-focus and self-blame, self-criticism. Then you lose touch with what's happening outside, around you. Sen no yokubo is another concept, very critical, especially in the therapeutic intervention. Sen no yokubo refers to desire for life, or desire to live fully in good health and in a meaningful way. And this meaning conference very much addresses our desire to live in a meaningful way. It doesn't have to be a philosophically meaningful way. It could be that you just want to live and be responsive, stay in touch with what's happening. If you need to tie your shoestrings, you should do that rather than saying, why don't I feel motivated to tie the shoes? So self-absorption puts in an extra step. Bilaterality principle refers to the two-sidedness. For example, it could be more than two sides, but you could be scared, but you could be excited. An English expression like, I'm anxious to do something, but I'm anxious about making mistakes. Even that word, anxious, has sort of behavioral side. We have ups and downs in life, of course. You can always look at the negative side, the darker side, and then fail to acknowledge the positive side. So bilaterality refers to two-sidedness, and some people would kind of take a dogmatic approach saying people should be always honest no matter what, and fail to recognize that we also sometimes become dishonest or change or withhold information and not to be entirely transparent. So we operate in layers to some extent, and that's human nature. But for some people who are, say, idealistic, dogmatic, or perfectionistic, can only accept one version of reality, one version of personal experience, and reject the rest. Subjective amplification of discomfort. I don't know, I just want to share one story with you. When I was in grade 3, we school kids were warned by school teachers that we should not play in the rice field because they were using the very powerful and poisonous chemicals like DDT. And on my way home alone, I kept saying to myself, I should not get into the rice field. I should not even smell. And I was preoccupying myself to the point of myself kind of leaning toward the edge of the street, the edge of the path, and then I fell into it, actually. And of course, on my way home, I was crying, saying, I'm going to die. Anyways, so that was one of my neurotic episodes. Aruga mama is a Japanese word. It's not Portuguese word for grandmother. Aruga mama means in Japanese the way it is, the way things are, the way I am. So being or as-isness. Sunao is another Japanese word that describes the personal quality or characteristic of being simple, appreciating the experience as it is. For example, if someone offers you a piece of sandwich when you're hungry, and you feel very thankful, and then you say, thank you so much, and just a small piece of sandwich, not a big deal, and you feel moved, then when you are sunao, you can simply accept your emotion and also express it. But if you would say to yourself, well, I'm a big wig in this conference, and people should serve me, and I should be treated like a VIP, then I'm tampering with my spontaneous emotion, spontaneous expression. So that's the opposite of sunao, anti-sunao. Sunao is a Japanese concept that's often used to educate children with. If a more experienced and maybe wiser adult would say, don't do this to a young child, a young person, and if the young person says, why should I do that? Challenging the wise advice, sometimes parents or adults will say, well, be sunao, just accept an advice as it is and appreciate it. So sometimes that's used as a way of culturally training children to think in a certain way. Sunao is another key word. And then choice of action, and we talk about choice a lot. There are things we cannot control, and there are things that we can control, we can choose in a small way, if not a big way. And the choice of action and the choice of the purpose of the action. For example, I may choose to drive in a very congested traffic, and I may experience a great fear of death, a fear of a car accident, but because I want to get to a certain place, because someone's waiting for me, someone dear to me is waiting for me, then in spite of anxieties and other things, I would do so. I choose the action, and that action has a purpose. It's a purpose that pulls me forward. Even though it's anxiety that pulls me back, my desire to fulfill, move toward that purpose or goal acts as an engine rather than brake. So do you have any questions about these concepts for the time being? As the workshop progresses, you will probably understand the depth of these concepts in different ways. Now, one of the things that media does is to, in a positive way, educate people, inform people. At the same time, media conveys the kind of messages that indoctrinate people in thinking and believing in certain ways that are not necessarily growthful or helpful. What I mean is that sometimes children watch TV shows and pick up media messages, and when they keep saying, smile and be happy, and that's the right way to be, the right thing to experience. And if you can't smile and if you can't feel happy, then there's something wrong with you, kind of thing. And when you look at say, very slim, beautiful women on the screen, the message is that's the desirable state of being. That's how you should be. So you end up feeling ashamed or embarrassed, etc. in comparison. So media actually plays that kind of conveys the value and the models or ideals, and people try to emulate them or try to be like them, and at the same time they compare themselves to such projected images and the messages, and then become self-critical. One of the aspects that I want to talk about is anxiety. And let me ask you, how many of you have experienced anxiety? Go ahead. One way is to be totally in control of anxiety somehow, and then anxiety-free. Because the media says anxiety is bad, or you should be able to talk yourself out of it, or a mature person won't feel anxious. A number of messages are rather hostile toward anxiety and shaming toward people who experience anxiety. What's nice about the counselors and group of counselors or people in helping professions that we tend to kind of break that boundary and share those tender feelings that may be seen otherwise imperfect or undesirable, and that sharing gives us the solidarity and strength amongst human beings. That's what support group is wonderful about. You've experienced anxiety, and when you look at, when you reflect on how you're raised, how many of you got the message as you were growing up, at school, at home, that anxiety is not a desirable thing? Anxiety is an undesirable emotion, or you shouldn't be anxious. All right. Okay. Stop worrying. Yeah. We always say that to each other, like, don't worry, don't worry. It doesn't make you stop worrying. It makes you stop talking about worries. So in that respect, now, sometimes in a quiet way, we indoctrinate each other into thinking that anxiety is not a mentionable thought or state. Being introduced as a reserved person is good. Being introduced as an anxious person is bad. Even shyness in this culture is considered sort of a slightly negative trait. In the, say, Japanese culture, being shy sometimes works in a positive way. So there are some cultural differences around what emotions, what personality traits are acceptable or even cherished in a positive sense versus others.
I was just thinking that so often I hear people say that, and this is going on in my family, I worry about, and it's like an alternative to action. And it's almost like a noble thing to do.
Mm-hmm.
I feel so guilty, I'm worrying so much. And that's another way of saying I'm anxious, I think. But I'm so wonderful.
Right. Yeah. Another example is the linguistic structure that we adopt unconsciously perpetuates that anxiety and then disability, action-wise. Anxiety is an emotion or affective state, and action is a behavioral side. You could, from a Moritian perspective, you can be anxious and still take action that needs to be taken. I call it anxious action taking. However, look at the expression or the structure, sentence structure. I'm so anxious, so I was so anxious that. Can you complete the sentence? Just make up a sentence. I was so.
Wait to get here.
I was so anxious, all right? Or I was so anxious that I could not do such and such, right? I wanted to speak up, but I was so anxious, I was so nervous that I could not speak up. As if anxiety literally stopped you from moving your lips or raising a hand and engaging in the speaking behavior.
Or the other way, I was so anxious I had to.
Mm-hmm. Right. So in that respect, anxiety, the state of being anxious propels you in a certain direction. Often we use this blaming anxiety kind of approach. I was too busy, I was too nervous, I was too scared to do such and such. What it means is that anxiety stopped me from taking action. And we use that quite often as a way of explaining things, explaining the lack of action. And taking sort of more realistic, even harshly realistic way is to say, well, you chose not to act. You felt anxious and you chose not to do anything. And you chose to blame anxiety, or you chose not to do anything behaviorally while you were feeling anxious. Yes.
A graphic example of that I was introduced to by a psychiatrist I was seeing, and he was seeing a client who flies commercial airlines who suffered from anxiety and panic disorder. And I thought, oh, wonderful. But it later made sense that when he was flying, he did not experience panic and anxiety disorder. It's when he was not flying. So the action of doing the job he was focused,
right.
But it was after when he couldn't fly 24 hours a day, that's when he got problems
right.
with anxiety and panic disorder.
Okay. Now, I want to kind of follow up on what you have said. One of the concepts is in Morita Therapy is the fluidity of emotion, fluidity of the subjective experience. And that kind of ties Morita to the Buddhism in terms of the philosophical orientation of worldviews. So, first I need a little object, and I'm going to bring this artificial tree to the center. We're going to engage ourselves in meditation. Okay. So we will use some of the experiential activities for further reflection and learning. Here's a tree, artificial tree, whatever you might call. Let's assume that you have been attending the training workshop or camp where you have learned to meditate and concentrate. And you can eliminate all the psychological noise, mental noise, and just be one with what's in front of you. Okay? And I'm the meditation leader, or say guru. And let's just pretend. All right? Folks, you have learned how to meditate. And I'll give you 30 seconds to become fully one with this tree, with this object in front of you. And when you become one, you will not hear anything. You will actually don't see anything other than this. All you have on your mind is a picture of this, the feeling of this. You're not going to engage in thinking. You're not going to be distracted by anything else, because you will achieve this temporary nirvana, the state of enlightenment, like this, because now you have learned how to meditate. So I will give you 30 seconds to eliminate all the noises, eliminate all the distractions. And those who can achieve it will pass this course. You have 30 seconds to become one with this and shut out all the noises, all the distractions. Let's see if you can do it. Go ahead, please. Okay. How many of you have achieved? How many of you have achieved this total oneness and non-distraction? No? All right. So tell me what happened. Tell me what happened.
I started thinking about my mother.
All right.
You said that I had to do this. When I stopped talking, I noticed everything moving and That's what I was mostly aware of.
You try not to be distracted, and that you kept getting distracted. Any other?
I want to be violent toward you, but you wouldn't be violent.
Sit down. Shut up. Right? Okay. Good. I'm glad you didn't act on that. But thank you for sharing. Any other responses you would like to share?
I kept arguing with myself every time I thought in my mind. I was reprimanding myself for allowing that.
So you were busy. You were very much mindful and distracted in that respect.
I noticed one thing, my heart is slowed down.
Uh-huh.
And then my focus is either, how you stare at something and the eyeballs go funny. It's done to out of focus. At the same time, also very sharp, knowing what my environment is and however they I don't really care what's going on. I'm really aware of it. And however, as I said, I don't see anything except a very fussy image of this.
But you didn't become one with this thing and forget the rest of the world. You are self-aware while you're also aware of this and many other things. All right. Yes, please.
I was thinking of, there might be one of us who really become one with this tree, and then I would say, that'll be embarrassing for the rest of us.
What kind of diagnosis? Right. Okay, so you're becoming quite busy, very much engaged in thinking about those things. All right. So now you're in a separate meditation camp. I'm a different meditation teacher, all right? So we're going to do a comparison of this experience to the last one. This time, the instruction is this. You control the eye muscles, the muscles around the eyeballs, so you will remain focused. But you allow any thoughts and feelings that come and go. Just acknowledge and say yes. Instead of saying, no, don't feel this way, don't be distracted. Allow yourselves to be distracted, but you can choose to keep your head more or less focused rather than, if you find your head turning away, then just tell yourself, back on task. Task at hand is to be visually focused on this. Become one, not one, doesn't matter. All you do is to let any thought and feeling come and go, and acknowledge each one. When your mind is floating away, just thinking of your mother or someone, you can say yes and back. Yes to any thought, any feeling that comes to your mind, comes to your mental screen, but then move back to this. So remind yourself that your job here is just to be sitting and facing in this direction and just looking at this. You can look at any part, the entire thing, or engage in any free association, but be visually, optically, be focused. All right? 30 seconds, please. Is what is natural, what is normal. Could you really expect yourself to willfully generate this experience of oneness or non-distraction, which requires more effort? And how did you feel about the first exercise versus second exercise? Just a few comments. May I invite you to...
The second one was less anxiety producing.
Why was that?
Well, I think I was younger, but when you told me, I could think of, if I thought about my mother, it would be okay. I didn't think about it. I have fewer thoughts.
Right.
Well, there's no, you can't fail the second time. You can't the first time.
You're not forcing yourself to have a certain experience and reject the rest. Right.
When I found focusing on visual, then I started, I kind of had a sore knee, and I realized that all of a sudden, oh, my knee's sore. I'm trying to look at something, my knee's sore. And I was like, it's like the body is interrupted.
Right. Yeah. Please.
I found the first time you said be one with the tree, I was feeling like I had to look at the whole tree, and it was in doing that I would then be distracted by you watching over there.
Right.
So whereas the second, yeah.
Yeah, you recognize that.
But the second time you said you could focus on whatever part, so I found by looking just at the smaller leaf, that was much easier. The second.
The experienced swordsman or Buddhist priest can let go of the experience of the moment and then be ready for the next one. And just take it as it comes and pass it through, rather than holding on to one experience and reject a new experience. In a way, using the Gestalt psychology and Gestalt therapy perspective, it's natural and it's organismic to have what's in the background come to the foreground and goes back and forth, kind of in a rhythmical way. It's a natural, spontaneous way. If you say, I should not feel this, and then you're exercising a lot of effort for control, which backfires in the form of narrowing your vision or feeling imperfect about yourself, and you get further engaged in the self-criticism. And even though some people can claim that they can instantly attain that oneness and cut down all this distraction or inner noise, I'm not sure. And when it comes to self-instruction, we sometimes mislead ourselves by saying, I've got to feel motivated. Like when you study, when you write something, and one way is to feel motivated and then go to the computer and work. Another way is not to feel motivated or not to expect yourself to be motivated, but as you start writing, you get motivated. And yet, when you get hungry, you start feeling hungry and distracted by that. Sort of concentration, motivation are going up and down. Please.
Carol had an interesting idea when she said that by focus the second time, it was easier to focus on everything at the same time. Because focusing on the tree.
Actually, I think it was the opposite.
Okay.
I'm sorry.
Go ahead.
I didn't hear so much what somebody said. It's the first time when I was to be aware of what was going on, and I was very aware.
You're distracted.
And then the second time, I was a lot more relaxed. And I don't know if I achieved the goal any better, but it was just
Right. It was easier to,
yeah.
So you were less distracted second time. There's less.
Much less.
Yeah. I think what Paul said also talks about this, the one side of what you're talking about. There's a Japanese martial art concept called Happo-moku, or 8-direction eyes, 8-direction sight, which means when you hold a sword and face the opponent, for example, if you are overly concentrated, then you get preoccupied, or you focus on the tip of the sword and you cannot respond. 8-direction eyes means you just relax, you can see everything around you. 8-direction means all around. So by that, you are more in touch. You're not focused. You're not willfully focused. You're not saying, I've got to stare at this person, or focus on the sword movement. Your whole body is relaxed and be more responsive in that respect. And your eyes are relaxed, and it's focused in the middle, but peripheral vision is also very much alive. It's a narrow focused vision that's also functional, but at the same time you're in touch. And that's, in a way, that's your experience too. The first time, you're fighting so much that you got distracted. You end up focusing more on the noise of the chairs hitting against each other, like coughing, and
It reminds me of the scene in Star Wars where Luke Skywalker is becoming aware of the Force.
yeah. Yes, please.
The other experience I had, like in the body, was a softening. It's almost as if the little neurotransmitters were, instead of fighting each other and on edge, they were softening. So it just felt like a more comfortable body experience to the softening.
Yeah. You might say it would be desirable, it would be nice if you could be enlightened enough to be fully in one with that object. It happens and it goes. There's a Zen story of a training monk coming to the master saying, Master, I've achieved the enlightenment. And the master hit him over the head with a stick. And then suddenly he said, I forgot what I was enlightened about. In other words, you've experienced enlightenment or whatever, or oneness, or in this case, the loss of self, loss of the thinking self. And it's considered a form of enlightenment, mini enlightenment. But that's a very momentary experience. After that, you say, oh, I've achieved it. Having said that, you have not achieved it anymore. You've lost it. Anyways, I would like to engage you in the next little exercise, and I would like you to take one sticker from this, and then I'll just pass these around. Could you pass this way? Pass this way, please. Thank you. Now, what's this for? It's not a name tag. You already have a name tag. Instead, this is for you to place on the top of the nose. If you have a skin condition, you might decline this exercise, but you go like this. But I want to put it in such a way that you could see the tip. Okay? The tip of the nose should be visible. All right? The tip of the paper, yeah. So think of this as an extension of your nose. There's a clinical term, the fear of the nose tip. Some And people become so preoccupied, they walk around, all they see is the tip of the nose. And sometimes, pimple? Yeah. Some people kind of overly focus on the so-called physical defects based on their own judgment.
Teenagers.
Yeah, what?
Adolescents.
Yeah, adolescents. For example, I won't show it to you, but I have a birthmark around here. And as a school kid, I used to wear shorts. The shorts were too short to hide it. Nowadays, kids wear baggy pants, baggy shorts, but in those days, they were very short. So there's a picture, school picture of me with my classmates standing like this, pulling down, not to be noticed. Okay. Let's just hypothesize this conference. It's a conference for those with a big, ugly nose. Okay? So you're born with this, not only big, but an ugly nose for you. You've felt ashamed of your nose all your life. Sometimes you're ridiculed. Someone would say, wow, how come your nose is so big? Even a bird can sit on it, so to speak. So let's just create the what I call neurotic, artificial neurotic condition. You are very much nose aware, part of yourself, and you have blamed yourself, you have blamed your parents for giving you this kind of nose. You think that you are the worst case, you are the worst sufferer of the big ugly nose. The whole world revolves around your nose, as far as you're concerned. Wherever you go, you think that others are watching you and criticizing your big ugly nose. You're ashamed, embarrassed, and also resentful. You think that other people have less of a problem. Their nose problem is not as serious as yours. You are the worst case scenario. Now, you're going to stand up and mix, because the organizer of this conference kindly arranged this social mixing event. Your job, however, for this particular exercise, your task is to be physically focused, visually focused on the tip of the nose. So that's the tip of the sticker. At all times, when you find your eyes going up, looking beyond the nose tip, remind yourselves, please, that the instruction for this particular exercise is to stay focused. And remind yourself every 30 seconds what an ugly big nose you've got and how others might be laughing at you. All right? And I have to un-neuroticize you afterwards so that you won't walk out with that nose complex. But for this exercise, you have just capture this exercise, the essence of this exercise. You have 1 minute to socialize, and you want to find out where they're from. You can verbally engage in a hopefully meaningful conversation, but please be visually, optically focused on the tip of the nose. Sometimes your eyes get crossed and then you get tired, so don't overdo it, but just your focus should stay on the tip of the nose and verbally remind yourselves of the ugliness, tragedy of your life, and how you have missed out on such wonderful opportunities if your nose had been normal. You would have been paired up with someone wonderful and attractive, but because of the nose, people have moved away from you or lost friends, etc., lost opportunities, and even career is not going that well because of the nose. And here's a conference where you think that you are the worst case scenario. Others' experience does not correspond to your own intense and painful experience. And engage in a self-introductory kind of discussion for the next 2 minutes, please. Go ahead. So just walk up to someone. Can be pairs, can be triads, can be. Good to see you. So please visually focus on your nose. Look at the nose tip, please. Look at your big ugly nose. Hi, Cheryl.
Oh, hi.
Hi. So where are you from?
Well, I live in Vancouver right now.
Oh, I see.
Yes, yes.
Yeah.
And how long have you been in Vancouver?
Oh, I've been here since 1986, so
yes.
about
yeah.
long time, 17 years.
Oh, yeah. Well, it's very good to have a conference, be able to come here and talk about noses.
Right,
yeah. Enjoying it.
Well,
Are you?
nice to meet you.
Yeah,
Yes,
yeah.
yes.
Thanks.
Yeah.
I guess I want to run it.
Look at your nose, please. Ten more seconds, please. Stay focused on the nose.
Hi. Yeah, and you are?
All right. May I interrupt you for a moment, please? Next instruction, we'll just take you right to the next one, then we'll talk about contrast. This time, nothing has changed. Your nose is still the same, which you might consider big and ugly. Now the task at hand is to find out more about each other. Let the other person know about your background or whatever. Find out something in common, because you might want to get together with a person, or you might become friends. So the purpose is, in spite of the big nose, in spite of this little thing that comes into your vision, you have to acknowledge, yes, I recognize you, big ugly nose or whatever. You may occasionally have the feeling of shame or embarrassment about your nose. Simply acknowledge it, as in the second part of the last exercise. Say yes to everything that comes to your mind. Remind yourself that the task at hand is to share information and find commonalities. 2 minutes, please.
Do you have reflecting teams there, or
It's interesting exercise, isn't it? I think we all feel. I think it takes me some time to learn how to do these exercises. I'm not used to doing exercises, so it's nice. Have you been here for the first time? First time at the conference. Me too. I think we probably all learn something from it.
You practice medicine in Vancouver, downtown.
Yeah,
clinic
in Vancouver. In a private clinic. General practice. Yeah, I'm not a psychiatrist. Yeah. So.
But you end up dealing with emotional issues.
We all have to. Not sometimes, all the time. All the time.
Yeah. So there's always a parallel.
So yeah, these exercises are good. Every exercise it raises a lot of questions. I think even for one exercise you can ask a lot of questions. Interesting.
And I'm thinking of, we're talking about preoccupation with physical, but I'm also thinking about people that get stuck in support groups, recovering from sexual abuse or something.
Right.
They get preoccupied with that identity and not being able to sort of
That's right.
live out of it.
Exactly. I was going to talk about that too, but if you have any thoughts to share with others, please do. Because the application is quite, it's wide.
And even in terms of working with First Nations people and their history being so much trauma and people getting preoccupied with that, part of that also being part of the identity.
That's right.
Seeing racism, so much on that need. So I can see this would be a good exercise to do with all sorts
That's
Do you teach at UBC?
Yeah.
Oh, I thought they introduced you in the brochure as you are a psychiatrist from Korea or something.
Oh, really? maybe I have a double or something.
Oh,
No,
have you been teaching at UBC
for
these years, right? Oh.
for 17 years. So,
17 years?
16 years. So
I see.
before I was at UVic, that's where I met Hazel.
Really? You teach psychology or?
Counseling psychology.
Counseling psychology. Are you a psychiatrist? No. You Ph.D. in psychology. I better check my internet again.
I want to know where Harriet Bay is, Hazel.
on Quadra Island.
Oh, I see.
Yeah.
Okay. So Hornby and Quadra.
It's
before-
Hornby and Denman and then further north at Campbell River.
Oh, Campbell River.
What bay is that?
Cortez Island. Oh, okay, that's right.
Quadra Island,
Yeah.
you know where Campbell River is?
Oh yeah.
It's the island's right.
Right.
It's just
Not too many people living there.
not a lot. It's,
10,000.
well, on Quadra Island, it's about 5,000.
10 seconds to wrap up.
Oh, I went to Quadra Island once. Scared. I went to Campbell River, and then I got my wife and my two little teenagers, toddlers, and I thought, oh, let's go to Quadra Island and live. So I went into a motel. I drove to a motel, and then there's a woman who come up to greet us, and then your hair was sticking like that, and then she got all the curlers. Okay. That was
All right. Let's take a moment. We're gonna wrap this experience up in terms of reflecting on the difference between this and that, the first exercise and the second exercise. I'm going to ask you to break into groups of 4 or 5, and just talk about the implications of this, because obviously you're generating, from a clinician's perspective or psychologist's perspective or educator's perspective, you're kind of getting the implications of this exercise. So instead of my telling you what these should mean, I would like to share with others.
Can we take these things off?
It's up to you. If you really feel attached, but peel it off very, very carefully. Please form groups of, let's go, can you go 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, 1, 2, 3, 4, and 1. Good. One's go to that side, 2's on this side, 3's on this side, and 4's on this side. Right where you are, exactly. And you have 5 minutes to talk about your thoughts, ideas, and implications. So one group is missing. Can I trade and have you go to that?
Okay.
happy to stand up or just stretch out if your back is bothering.
I think
So what was the one?
oh, thank you.
Yeah. Even when it wasn't, really when you were getting into the book, you were looking really good at how the drive works. I don't think you can get that. Yeah. Try to pause here.
Tell you a story that picking up brother-in-law person busy minister of government ministry of state, and very, very powerful. You want to think about what she had this really did. She's instructed her children. Now, he's going to come here. He's going to have these kids don't say anything about it. He's very sensitive. And the dinner started, and one of them just not. Finally, after the dessert, she relaxed. She said, well, finally we got through that without it dressed. So she served coffee, and she had it in this coffee, and she said, would you like one or two cups? I want to smell some sugar.
Yeah.
Yeah, you see how you do
There's a strange contrary. There's a break, wanting to break rules, wanting to fight against ourselves. Somebody says, don't do this, one do this, and you don't. I don't know why. Maybe that's that reason. Wanting to do what other people say you can't, or not wanting to do what you say you want. Fromm says it's freedom is always freedom and constraints. Were there any surprises for you?
Not a big surprise in the sense that I have gone through this, but each story, the story that each person brings into this kind of discussion is unique. Like in your story, there's paradoxical kind of effect, and when you say don't shake, and then all you think of is shaking, and then you end up trying not to shake or tremble like this, makes it even worse. That's the amplification effect. It amplifies when you focus on it. When you try not to let it happen, it happens.
Having learned about interview, Your next task is to add
Right.
distracted in order to having learned
Yeah.
next task is
And that this not being distracted is just a byproduct of that mastery. It's not that you're trying not to be distracted. Then it's a reverse.
sort of a way of creating ourselves like that.
Yeah.
Like the whole idea of having some comparative society when they work through the fear factor. This idea of flow, of acting
Like everybody else, that's over.
allow the fear, but also have a vision of what allow empathy, that's what creates depression.